Everyone. All right. Good morning, everyone. It is so lovely to see your faces. We're going to give a couple folks a few more seconds to get connected to audio and join the meeting. While you're waiting, as our usual standard measures for Zoom meetings, please make sure that your name is listed the way you want it to be listed. If you don't know how to do that yet, boy, you've been lucky enough to not be on many Zoom meetings, but you go to your screen and you click in the upper right-hand corner and there's an option to rename. Remember to stay on mute unless you are trying to ask a question or respond to something, and use that chat box. We're going to have a short presentation first, but we'll have your chat box questions to join with the other questions that were submitted via the registration form. So with that, I'd like to go ahead and get us started. We are so pleased this morning to be joined by some real experts in our field who I'm going to introduce in just a minute, but I want to just take a minute. This is hard. It's really hard right now, right? And it's changing, it's challenging, and I think what our role is to make sure that we are equip ourselves with the information and the strategies so that we can keep meeting the needs of children, youth, and families. And how we keep our eye on the future, right? Like, this is going to get better. Seems really tough right now. But what we can also do is to make sure that we support one another and reach out, check in with one another, listen, really listen to how your colleagues are doing so that we can keep doing the best job that we can. I want to introduce our panel of experts this morning. We are so pleased to be joined by Katie Leffel and Molly McClintock, who are both from the Department of Health's COVID response and recovery team. If you guys can unmute and say hi for just a second.
Hello.
Hello. Thank you.
So you should be seeing them pop up in your screen. We are also pleased to have Brina Holmes and Becca Bell, who are both pediatricians and are here to help add to our conversation this morning. You guys want to unmute and say hi for a second?
Hi, everyone. I'm happy to be here.
Hi, everyone. Great to see you. Thanks
Great.
for all you're doing.
Awesome. So Katie and Molly have a few slides that they're going to share with us just to give us some context setting and walk us through some of the basics. And then we have some of your questions, and we'll facilitate the rest of this meeting as kind of a conversation between us and our panelists and you all, so that we can walk away at 11 o'clock with information that we're that we feel solid about and that we know how to move forward with these next few months. So Molly and Katie, I'm going to turn things over to you.
Hello, everybody. So I'm Katie, and I just also want to acknowledge that there's a few other people here from the Department of Health. We've got Lisa Stahlberg, and I think Nate Waite might be joining us as well. We also have Allison Lafferty from epidemiology as well. So we have a lot of people to answer questions. I'm very excited about that. So we just wanted to quickly give you a quick intro into the process here. We already did the moment of acknowledging, how difficult the past few weeks have been for all of us, and Omicron hitting so quickly, and we're all grappling with the changes to the guidance, and as well as introduction of new programs that affect the children that we work with. There's a lot of material to get through in this hour, so and we also want to make sure that we have time at the end for new questions. So to set the agenda, we're going to be reviewing a quick overview of Omicron, the quick overview of the new isolation and quarantine guidance. And then lastly, we'll go through all the questions that were submitted and then answer any new questions. And I just want to take one more moment to just acknowledge that guidance is changing rapidly. We all know that. So we are going to supply links as well to some of the information we're giving. And we encourage people to check those links frequently because things keep changing. So the best thing to do is go to the Department of Health website and actually get the information as it's updated.
All right, so I'm going to start off just by kind of giving us an overview of what's going on with Omicron. I think we're all having a sense of COVID fatigue. I know I for sure am. And having this recent surge is not helping at all. So it's just everywhere right now, and I know it can feel really scary. And we just want to acknowledge that throughout this pandemic, we've talked a lot about personal responsibility. And while we each do have a personal responsibility to, follow these basic public health guidelines, we also need to acknowledge that at this time, it's impossible to expect to keep Omicron out of all programs. Testing positive for COVID right now is not a reflection on people's behavior. It's not a reflection on how safe they are. It is a reflection on how contagious Omicron is. So we just need to remember it's nobody's fault when someone gets COVID. We need to just have compassion for each other as we get through this. So just wanted to start with that. So although Omicron is feeling really overwhelming, we also want to acknowledge that we're understanding more about its impact recently. And that's helped us to make some of the changes that we've made. So we want to just talk a little bit about what we learned about Omicron. So the first thing that we've learned is that it's more infectious, as we've seen, but it's also resulting in less severe illnesses. So even though we're seeing really high case numbers, the symptoms themselves are less impactful, especially if you're fully vaccinated and boosted. And although we're seeing more positive cases in children as well, we also continue to see no significant increase in severe illnesses for children. So that's good news. We're also seeing with Omicron that the incubation period itself is shorter. So this means that someone with Omicron infection might be contagious as early as 1 to 2 days after exposure. And we've also seen that they're infectious for a shorter period of time. So when we have that shorter incubation and contagious time together, that's what makes us know that it's safer to shorten the quarantine and isolation guidance. So I know that there's been a lot of questions about why it's shorter, and it's because we have those two things that tell us we're getting the infection faster, but we're also contagious for a shorter amount of time. So we don't need to isolate and quarantine for as long. And regardless of the variant that's going on, we're going to remind people probably too many times that basic public health measures are going to be vital throughout this pandemic. So getting vaccinated and boosted if you're eligible, wearing high quality masks, staying home when sick or are experiencing symptoms of COVID, getting tested if you have any symptoms, maybe a close contact, or have taken part in activities that could put you at risk, such as large gatherings or travel, washing your hands regularly, and getting your flu shot. And like Katie said, we'll again say it many times, this information changes. What we know in the medical field changes. As the virus changes, so does our knowledge. So what we know today may be different tomorrow, and we just will do our best to keep you informed, but again, continue to check the webpage and see what what the latest guidance is.
Okay, thank you, Molly. And so the next thing we're going to go over quickly is changes to the isolation and quarantine guidance. So we have a couple slides up that are basically cut and paste from the Department of Health website with what you'll see when you go to those web pages on the Department of Health. But what I really want to do instead of going through those slides is to just really highlight the changes, what has changed recently. So the main changes to the isolation after testing positive for COVID-19 updates. So you can get out of isolation after day 5 if you meet certain requirements that are listed on the slide. And the rationale again for this, like Molly was talking about, is the infectious period of Omicron is shorter. So you should still wear a mask around others through day 10. And although they cannot mask, children under 2 can leave isolation after day 5 if they have no symptoms. And 2 to 5-year-olds, you're doing the best you can with masking, right? I have a 5-year-old, I know what that's like. But they may leave isolation after day 5 if the other requirements are met, even though they can't mask necessarily consistently. And then the last caveat is that if a child has a disability and is also unable to mask or mask consistently, they can still end isolation early if the other requirements are met. And then the main changes to the quarantine after being a close contact for those not fully protected, meaning fully vaccinated for children and vaccinated plus boosted when eligible for adults. So that's fully protected. You can get out of quarantine on day 5 if you meet certain requirements, again, listed on the slide. So the rationale again is this incubation period of Omicron is shorter. So you should still wear a mask around others through day 10. Children under 2 years old in quarantine can take a PCR test on day 5. So children under 2 years old cannot take the antigen tests, but they can take a PCR test on day 5. They can leave quarantine once they have negative results, even though they cannot mask. There are not currently at-home tests available for this age group, but we are exploring the options that do exist currently. 2 to 5 year olds, again, do the best you can with masking, but they may leave quarantine on day 5 if the other requirements are met, even though they can't mask consistently. And then again, if a child has a disability and unable to mask or mask consistently, they can still end quarantine early if the other requirements are met. There is information on the Department of Health website on how to isolate and about notifying your close contacts as soon as you receive your positive test result. We can't say it enough, as you've seen throughout COVID, information changes frequently, especially with notifying close contacts and how that works. So I would urge everybody to just check the website where the updates are posted. And
Right. Go
and then
ahead.
I just want to say we will be supplying people with links to the appropriate websites as well.
So we're going to move into the questions that were submitted prior to this. And we just wanted to acknowledge there were a lot of repeat questions. So we tried to theme them together. So if you don't hear the exact wording of your question, it's because there were others like it, and we tried to be efficient with the time to make sure we could get to everything. So the first thing that was brought up was just asking about guidance for children under 2. And it's really tough because the guidance that you see most places tends to focus on the over 2 age group. So we just wanted to review a couple things that Katie just went over, but just to reiterate it, things to think about with children under 2. The first thing is that antigen tests are not to be used for this group. They have not been approved for this group. So the only tests to use for under age 2 is the PCR lamp tests. The other thing is that masks are not appropriate for this age group. There's just no reason to mask them, so we shouldn't be doing that. It's developmentally not appropriate for them. As Katie just talked about, we're not doing a 14-day isolation or quarantine for anyone. And then for this group in particular, the way we think about it is if they test positive for COVID, they can either isolate for 10 days, or if after 5 days they have no symptoms, they can leave isolation after day 5. If they are close contact for someone with COVID, they can either quarantine for 10 days, or if they get a PCR on day 5, they can leave quarantine once they get the PCR result back, assuming it's negative, of course. And we also just want to say, if you have if there's a child under the age of 2 and there's a new illness, we want to get them a PCR test as soon as possible to just make sure that it's not COVID. And if it is negative, they can return once they're feeling better. If they don't get a COVID test, but they're having COVID symptoms, we want to be treating it as if it is COVID and having them isolate for the 10 days, as we just talked about.
And others from the Department of Health or VCHIP, feel free to jump in on these questions if you have comments.
Yeah, the only comment I want to make that I'm sure Allison will support is it actually is accurate that people who are isolating can return to life after day 5, but people who are quarantining can get out of quarantine on day 5. Can't even tell you how confusing that is to the world, but it's true. And I'm just looking at Allison's face. Nod for me, Allison.
It is very confusing
on the website,
and very
so
true.
Actually, yeah, so it's day 6 if you've had COVID, because it's after day 5, which in my counting is day 6. We've had some good humor about counting, so at least we're trying to make light of some things that aren't funny. And then, but quarantine, you actually depart your house on the day 5, not, so policy decisions not made by anyone on this call.
Definitely not by the people on the ground doing the work, right? Because we wouldn't have that discrepancy.
Yes, it would be easier if it were uniform, wouldn't it?
Yeah. Well, okay, I'm going to move on to the next question here, unless anyone else has comments. Okay. We had quite a few questions about access to test kits for after school programs. So I'm just going to read the Department of Health response to this word for word, just to make sure it's really clear. So the health department continues to listen to and work with our community partners and have staff dedicated to these efforts. We're in the process of organizing a distribution program to get test kits and other materials to community partners at regular intervals. As we know, due to ongoing testing limitations and supply limitations, the current need to ensure school and child care facilities have access to test kits, we do not yet know when kits will be made available directly to partners. But that is a matter of when, not if. The state is committed to ensuring access to testing and other materials for Vermonters. And as supply limitations ease, we will keep this at the forefront of our testing planning efforts. In addition, the department continues to work with the Vermont Language Justice Project, formerly known as a multilingual task force, on getting out tutorials on how to use the tests as we learn they become available.
All right, the next question is, we are a program that serves students from several schools and they mix together. Are there plans to distribute rapid tests to programs like ours that will need to provide tests to families exposed to COVID at our programs separate from school exposure so that we can follow the updated guidance? So kind of like what Katie just said with that statement is that we want to get tests to people eventually. We don't have immediate plans that we can tell you about. The one update that we can share is that test to stay at schools has now been adjusted and is called test from home. And one of the updates that occurred with test from home is that the antigen test that students get is not just for school exposures. They can now get those tests with community exposures as well. So if there is a COVID exposure at your program, the student will be able to get antigen tests through their school if their school is participating. The one thing to keep in mind is if this does happen, that also means that they need to be quarantining outside of school and should not be attending the program while doing test at home.
I just wanted to quickly acknowledge the antigen tests. It's not that they're not effective for children under 2, they're just not, they're not authorized for children under 2. So we can't use them. It's not that they're less accurate necessarily, it's just that we're not allowed to use them for under 2. Okay, the next question. If test to stay continues to be the model to keep kids in school and childcare, we are very interested in access to test to stay program for vacation camp days when school is not in session. We don't need it for after school testing since they are tested during the school day, but are out of luck when school is not in session. So we definitely hear you. This is something that has been already discussed and we'll certainly pass along. Currently, there isn't any guidance on that, but we will certainly keep advocating for it.
Then we had some questions about sharing snacks and trading food and if it's allowed now. Unfortunately, we're still not recommending that.
Okay, next question. So we had a few questions around requiring proof of vaccination status for facilities or for camps, various things like that. So basically, I'm going to reiterate our basic prevention steps. As we know, vaccination, booster shots if eligible, staying home when you feel sick or have any symptoms, getting tested if you have any symptoms, close contacts or taking part in activities that could put you at risk, wearing a mask in indoor public settings, take care when getting together, wash your hands regularly, and get your flu shot, right? Those are the basic recommendations as for public health measures. However, when it comes to creating policy around these public health measures, for instance, requiring proof of vaccination, it becomes a business decision, and we are not advising on those.
So we had a number of questions asking about planning for summer camps, just both day camps and residential camps, and kind of what to expect. And unfortunately, we don't have a good answer on this one. You know, as we've seen with COVID, things are changing frequently and rapidly. So the landscape this summer could be completely different than what we're seeing today. And so regardless of if you're planning a residential camp, a day camp, we really have to wait and see, because we don't know what it's going to look like. So we can't make a recommendation.
And so this next question is specific, but it can be generalized as well. So is it safe to hold the Iron Chef competition this year? So again, it can be generalized to other events as well. So like any event planning right now, our guidance comes down to safety precautions in place. So while events are still allowed, you have to make sure things like masking indoors, testing, and adequate ventilation to keep those events as safe as possible.
And then we had some questions about what's happening with contact tracing. So I'm going to be dropping the link in the chat in a minute about our VDH page on contact tracing. And it walks you through identifying your infectious period, notifying close contacts, the number for the health department if you have questions. But it walks you through what you need to be doing for contact tracing. And if anything changes, it will be shown on there as well. I know a lot of people have had questions about the changes with schools. And although they're not doing contact tracing as we think of in the traditional sense, what they are doing is notifying people that there was a potential exposure. So even though they won't have the official close contact title, they will be notified if they had a presumptive contact with someone with COVID. I don't know if Allison wants to add anything to that.
No, that's great. That's true. And contact tracing in general, just to give you an overview, it's not on our website yet, but just for an early preview, we are changing contact tracing. The phrasing that we think describes it best is we're kind of switching from information gathering to information providing. So we have been prioritizing cases to the highest risk cases. Based on our case counts now, we are switching gears and we are actually going to call every positive case, but we are not going to gather information from them. We are just going to make sure they know they're positive and they know how to access our guidance, essentially. There'll be a few other things we provide for them, make sure they can isolate and make sure they have access to food. But that's it. It will be a 5 to 7 minute call for each one. We're not going to be asking them who their contacts are. We're going to be giving them the resources to identify their own and contact their own. This is in relation to the surge and to what's the most effective way for them to outreach and get in touch with people the fastest. So this will result in us not reaching out to childcare centers or schools and being able to tell them when they've had cases. And this is in line with the state's current shift, which is working more towards, like Molly and Katie referenced earlier, towards personal independence. That COVID is something we have to live with. I mean, this is going to be here for a while, and we all need to be familiar with what we're supposed to do about it. Test if we have symptoms, stay home if we're sick, all the things we're supposed to be doing about it independently. And we're here as a reference center to assist with that. So that is a big shift. That shift will be starting, assuming, fingers crossed, I get all the procedures done in time, on the 23rd. That will be a big shift in contact tracing. So not that less work will be being done, but it will be a different sort of work. And that's how it will impact schools and childcare. So it goes right along with the changes that you all are making anyway towards not contact tracing. It fits in line with that. Does that make sense?
Yeah, so Allison, I'm just seeing a question I just want to reiterate here. So someone is asking if a program that is not operated by a school, if they are still expected to contact trace. What I'm understanding is that no one is really contact tracing. It's really, you get your positive results and it's your responsibility to inform others that you may have been around that may be susceptible, correct?
Yeah, well, and if a business hears, so we have tools for like businesses on our website. So if you operate a business and your employee tells you they're positive, you can assist with that contact tracing. There's tools for them to do so, which they have been using for the last couple of years. So they can still assist them with contact tracing, but then it's up to the individuals to follow that guidance. They will not be receiving calls from the health department. Those close contacts will not. And they haven't been for some time right now. Businesses have been functioning independently. They just receive our packet of what to do when there's a case at their work. That being said, we will have guidance on what is an outbreak on our website. And outbreaks are different stories. Like with all infectious diseases, COVID will be one of them. There will be criteria for when you need to report an outbreak to the state of Vermont. Schools and healthcare facilities report outbreaks. And we will also give that to all businesses. Like, here's some criteria. If you have this many cases in this affecting this percentage of your staff, reach out to us and we can offer some additional guidance. So that will also exist there. Does that answer the question, Nicole?
It does. Thanks, Allison.
Sure.
Before we move on, there was another question that's was in the chat a few minutes ago. So after school programs that are serving students from multiple schools should contact trace. I think it's asking about like how to get tests for those youth. So can they get them through their home school if they're notified? I'm trying to understand this question. Maybe Daisha, can you unmute and ask your question? Oh, Daisha, we can't hear you.
Can you hear me yet?
I can, yes. Go
Okay,
ahead and ask. your
sorry
question.
about that. Yeah,
okay.
so if I'm understanding correctly, we serve students from multiple schools. And so if there is an exposure that happens here, that wouldn't be managed through the school because the exposure happened here. Let's just say we have a student from Edmonds Elementary School that tests positive, but that student is in a classroom here at our program with students from Champlain Elementary School. We should contact the school nurses for them to then get tests into the hands of the affected students. Is that what I'm hearing?
So I'm going to attempt to answer this, and
Okay.
feel free to break
Okay.
in
Thanks.
if other
Thank
people
you.
talk about.
Yep.
So my understanding is that they would be considered a close contact, and using the test kit, they can use the test kits from their school with community exposure. So they are able to use their test at home kits that they were provided from the school. And the number varies on whether they're fully vaccinated or not for those close community exposures. Does that answer your question?
I think part of it was about the communication.
Right.
You guys have to notify the schools and note each person notifies their close contact. So if I'm in your program and someone tells me that I am a close contact, I would then communicate with my school to say, I had a close contact, I need cases. So it shouldn't be extra work on you. It should just be that your students will have, or your participants will have access to the test kits. Does that make sense?
Yes, but so then we're saying that obviously a first grader isn't going to tell their school, so we're saying the parents should notify the school?
Yes.
Okay. Thank you.
Okay, so I'm going to move on to the next question. So the question is, how can I get grants to pay extra bills that are COVID related? So this is definitely something that we would reflect back to reach out to the CDD or the AOE. Also, I thought maybe Nicole, maybe you have some input into some guidance there, or other provide, sort of networking within the programs.
Yeah, I don't have any information to share on that yet, but yes, we are continuing to communicate the importance of funding to help support these additional costs.
All right. The next question is, any idea of when the COVID vaccine for those under 16 will be approved without emergency authorized use? I have no idea, honestly. I don't know if Becca does or Brina, but I have no clue.
Yeah, that's a great question. I actually don't know about that timeline. I thought the question was gonna be about kids under 5, and that is probably gonna be in the spring. So that basically for that age group, they're doing a third dose, and the participants have been enrolled and they're getting their third dose, and then they have to collect the data. And so folks involved in that trial are thinking probably more like March or April would probably be the timeline for that age group. And I actually, haven't really been following where we are with full FDA authorization in the other age group. I don't know, Brina, if you have. Has it? Yeah, interesting.
I have not. No.
Yeah.
That's a great question, though. We sort of, we shifted off of that a while back, but I'm sure somebody's working on it. Hey, while I'm unmuted, just because folks know I don't work for state government anymore, so I'm going to just say on the test supply front, that's a major advocacy point from pediatricians and American Academy of Pediatrics. So you're all aware, we're all aware that we're at this inflection point of we're shifting policy that entirely depends on rapid antigen access for children 2 and up, families and staff. And there's a large volume. We were told yesterday 390,000 tests are being distributed to our public school system, which might last 3 days or it might last a week. It's all about how we tell people how it gets distributed. And it's that what Allison said earlier about that personal responsibility piece is so fascinating. So we're going to sort of make some volume of tests available, and people are going to use them as they need for various aspects of their lives, whether it be they're symptomatic, they've been identified as a close contact, and it's all variable. So, but the tests are going to keep coming into the state. It's just we're not clear at what volume and in what distribution pattern. So I wish we could say it differently, but it's not entirely unhopeful. I mean, there are a ton of tests. It's just, we've heard from a lot of school nurses this week who do the math. They've got, 60 cases in their school, and each one of those kids has 50 contacts. I can't do that math quickly. That's 300 tests today, and they only got 1,000. I'm just sort of spitballing it here, but so we all need to just stay together in the advocacy here about where are the tests and whose hands are they getting into. And I know you all live and breathe equity and access so deeply, which is why the way it's being rolled out in schools feels better to me than leaving it to people's resort to figure out how to get online to order them or get their insurance company reimbursed, or even yesterday the website went live for the federal government to order 4 tests per household. None of those distributions feel equitable to any of us. So but we need tons of on the ground feedback in this arena to keep the math going. At the same time, we're hoping Omicron's peaking, heading back down, and then maybe the volume that we need will be less within a few weeks. So that's just my editorial today. I don't know if Becca wants to add anything.
I agree. Testing is, I'm not Becca, but I agree that testing is test supply has been an issue and is continuing to be an issue. I mean, we're fighting for tests in other populations of high-risk populations as well, like long-term care, shelters, like other congregate living situations. So it's across all sectors that we need more testing. And I know that people are working very hard on it, but I agree with Brina that continuing to advocate and put numbers to the problem is really important, just to keep it on the forefront of everyone's mind. But I do know that they are working really hard, because every day, you know, at the testing huddle, we're talking about the need for tests. I mean, because you're right, that is the pinch point of all of this, is if there's enough testing. So I agree. And I also agree with you that some optimism is we are starting to see some regularity of some tests coming in. So I think there is some reason to be hopeful that the corner could be turning here from what it has been the past couple of weeks, which has been pretty scarce the past couple of weeks. So hopefully it'll be turning.
And then just looking at the chat, and Kim had asked if the Omicron symptoms are the same or the specific symptoms to look for. And I think my basic understanding is that Omicron tends to focus on the upper respiratory tract, so more congestion, more nasal, and less of the coughing and the fevers, although continue to monitor all symptoms. Yeah, and then Allison also added not as much loss of taste and smell. And I also wanted to just say the next question we had was about the vaccine for those under 5, which was answered already.
All right. So we had a question about the number of hospitalized children for Vermont. And Vermont Department of Health doesn't publish those numbers, but we did want to just let you guys know that there will be new information on the dashboard regarding pediatric cases this week. The school table will go away and be replaced with new pediatric case data. And it's a much better look at what's going on in children from a public health standpoint than the school table was. As far as hospitalizations, children are being admitted to the hospital due to COVID with symptoms very similar to other respiratory viruses like RSV or influenza. The number of children hospitalized for COVID is less than those hospitalized for RSV during the winter months. So overall, our pediatric hospitalizations are steady. And I'm going to throw it over to our expert, Becca, to see if she has anything she wants to add to that.
Yeah, sure. So I work in the pediatric intensive care unit at the hospital. And, you know, I think one of the questions people ask is, when a child tests positive, are there specific things to look for? And really, it's just the same thing you always look for. If a parent's worried or asks, it's really the same stuff. What we're seeing is like very similar to what we see in other viruses. So in like very small babies, it may be like they have a fever, they're fussy, they're not feeding well, and we might need to admit them to the hospital for some IV fluids. We mentioned some upper airway involvement with Omicron. And so sometimes we're seeing some croup, but very similar to the type of croup, which is like that barky cough type of thing that we see. It's very similar to what like parainfluenza causes or influenza causes in terms of croup. In older kids, we can see, I haven't seen a bad COVID pneumonia since Delta. I haven't seen one yet with Omicron, but that could certainly happen. So there's nothing really new or specific. It's like what we think about with all viruses. So are they having trouble breathing? Are they having trouble drinking enough? Most children, I mean, I can't even calculate our hospitalization rate because it's so low. I think the number wouldn't even make sense. We have lots and lots and lots and lots and lots of kids testing positive, and very few children needing hospital care for this. Breaking news, I'm going to actually bring this up on our national call in a couple hours, but I have not seen RSV in 2 weeks. Just like went away. I don't know what's up with that. But so we actually, right at this moment, we're usually slammed with RSV right now in the hospital, and we don't have it. So I don't know what that means. I'm sure it'll come back because it always does, to really make our winters tough. But so right now, in terms of hospital beds and pediatric capacity, we're okay. We're seeing some rhinovirus. We're seeing a little bit of COVID. We're not seeing RSV. I haven't had a flu case hospitalized either yet. So So yeah, so it's just all the same stuff that we always look for. Like, are you worried about anything? Are you worried that they're not drinking? Are you worried about their breathing? Please call your child's medical provider.
Well, can I just add one thing that if those of you that are on Twitter, I encourage you to follow Dr. Bell on Twitter, because last week she was able to outline very thoughtfully the whole categories of children and hospitalization, which is getting a lot of national attention. Is actually kind of a fascinating analysis, because some children are hospitalized for something totally incidentally found out to have COVID because they came in for orthopedic surgery, or they came in to have, you know, some other procedure, and then because of the protocols, they test positive for COVID, right? So when you hear children in the hospital, it's not with COVID, it's and COVID for a subset. So again, depending on how your brain works and how you process information, the media can sort of overtell this story, and then Becca helps us on her Twitter feed get it back into contextualize, at least from her expert position.
And just a reminder that Vermont's very different than other places. So it's not to say that some of the stories elsewhere are not accurate or anything like that. It's just that we have one pediatric ICU in Vermont. We have one, you know, so we, those of us who work here have a sense of what we're seeing in Vermont, what we've seen throughout the pandemic. So we're always happy to like give you all info. It's not, you know, I would not say my colleagues who work in the South, they have seen, I mean, Delta was a totally different experience for them. So this is very specific to Vermont, and in particular, our high vaccination rates has really helped children here.
Thank you guys so much. I feel like that was like a little bit of a bright spot in the sense of contextualizing some of the information that we're hearing from the media in particular. So, and it kind of actually does inform this next question. So I'm going to read this question verbatim. Does it seem that we have just given into the fact that this variant is cold-like in symptoms and the way it spreads? Therefore, it is a bit more disregarded. So just thinking about that question, again, it's not that we're disregarding Omicron or giving up and trying to stop the spread of the illness. What we're doing is, you know, looking at the data, how quickly it spreads, how long it's infectious, and using that information to inform how we respond to it. So when it spreads quickly as it does, the old version of contact tracing was too slow, and we had to pivot to methods that are faster and more efficient. And then just like Dr. Ball was saying, the other thing to remember is this variant is more like a cold for those who are fully vaccinated and boosted if they're eligible. So that's really showing us in real time the difference that vaccines and boosters can make. So continuing to encourage those who are unvaccinated and unboosted to get vaccinated and or get boosted is key to maintaining our Vermont's great outcomes that we're seeing. And just remembering again that the vaccination and boosted people are protecting those who are unable to get vaccinated right now.
All right. The next question is asking, how can after-school programs provide a clean venue before the arrival of kids? How can materials be shared and stored in small group format within a larger multi-purpose room for other classes during school hours? So we've learned COVID is much more of an airborne disease, so we worry less about people getting COVID from touching surfaces. So really just following the regulatory guidance for cleaning and storing materials should be sufficient.
Okay, so how do we support after-school programs based in the community or in community centers if we have small spaces and can't properly social distance? So again, just focusing on the other measures like vaccination and boosters, wearing well-fitting masks, getting tested, washing your hands, and getting the flu shot, all those basic things. And then the other one is, if possible, really some great ventilation. So get the air flowing and keep kids outdoors as much as you can.
How can organizations support COVID testing in communities / with kids and families enrolled in a program with the recent pullback of surveillance testing and contact tracing in schools? How can organizations support this without depleting their budget entirely? So we want to remind everyone that these decisions, these changes about contact tracing and the changes in testing protocol were not made lightly. But in the case of Omicron, those the strategies we had previously were just not effective. The state, in consultation with our infectious disease pediatric advisory team, determined that PCR testing is too slow to effectively identify and contain the current variant. So schools will be able to replace their PCR tests with LAMP tests for diagnostic testing needs. And LAMP tests are as accurate as PCR, but they're able to provide an immediate result. You can always encourage families to sign up for State of Vermont run COVID testing if they want PCR testing. And then just a reminder that the new test from home allows community exposures. Kids can get the test kits from their school for any community exposures.
Okay, I'm just waiting for 1 second. Let me see if anyone will jump in. Okay. And then this is our last question that was submitted prior to today. Do you think it's necessary for children to wear masks outside? So 2 points. So in general, the guidance from the Vermont Department of Health is to wear a mask in indoor public settings. That's the general guidance. However, if a child has tested positive for COVID-19, so that's a different situation altogether, and they're able to end isolation after day 5, the recommendation is that they wear a mask for school activities, except for when eating. So during meal times, it's recommended that the mitigation strategies such as podding, sitting or eating with the classroom and facing one direction during meals must be implemented. So this is for children that have tested positive and have ended their isolation but are still masking. This masking recommendation should be followed during all school and school-sponsored after-school activities, including outdoor recess, sports, music, etc. If masking cannot be done safely, the individual should not participate in the activity. So this is guidance from the Agency of Education around children who have tested positive but are still in that 5-day masking period. And that is the end of our previously submitted questions. So we are open for questions to be answered right now too.
So I see a couple in the chat box that are coming in. One, let me start with, for programs that include homeschool children or students, how can they gain access to tests since they're not able to get them at school? Are there other avenues that they can get those beyond some of those websites? You know, like the federal one that just opened yesterday, the one that was previously open here in Vermont. Are there avenues for them?
So I don't know if someone else has an immediate answer for this. I honestly am not sure, but I will look into that and I can email Nicole to message that out to you, whatever I find out. I don't know if someone else has an immediate response, but that would be mine.
Molly, that would be super helpful. And I think, again, like that's another point, as Brina was saying, like that's the point where hearing from you all is really key so that we can address the equity issues that are present in the current availability of tests.
Yeah, my understanding is that, and this has been a source of some controversy, that the distribution of antigen tests is only to public schools.
Yeah.
Not to independent schools, not to home schools. So but PCR testing is still free and available in our communities through the health department website. But take-home antigen tests are not in the hands of people outside of that public school distribution, to my knowledge. So we'll do some follow-up on that. I mean, that's super important.
They are adding in, AOE just sent me a message yesterday, they're adding in private schools, but it won't be this week, it'll be next week, most likely, when they'll have tests for private schools. So I don't know, maybe we could follow up with them. Where does at home fit in with that? Because that wasn't addressed in that email.
That would be great. And then I'm happy to share that back out with everyone.
Molly, are you going to follow up with them on that, or? should
Yeah, I can
you
take
got
care of that for
Okay,
sure.
That'd be
Yeah.
good.
great, thanks.
I mean,
The
if
other
Elisa was here, she'd say that that homeschool children are in the purview of the Agency of Ed. So I wonder if that's
Like,
an
are they
easier path than
associated?
I'm.
Yeah, are they
Yeah,
associated
I
with
mean,
the district they live in, and could they go get
They
tests from
are,
that district?
yeah.
That's what I'm thinking, but I don't know that for a fact. So, but that was
Let's
my
find
thought,
out.
is they could go to the district they live in. and get them there, but
All right, so we'll let Molly follow up with AOE and see if we can get some information on that and share that out with all of you. Lindsay's asking, can we just clarify the difference between LAMP, antigen, and PCR test?
so LAMP and PCR are both types of what they call NAT testing, NAT, nucleic amplification test, and they're both types. LAMP is a rapid type and PCR is our like gold standard testing type, whereas antigen test is also a rapid type of test, but it tests for active virus. So am I infectious right now? Or PCR tests for the genetic material to see if it's there, so it can remain positive for a long time, up to 90 days after you've had an infection, after you've been first tested positive. So that's why we're using antigen tests to test out of isolation, because it can tell you if you're infectious right now. However, anytime that a PCR test is required, a LAMP test can be substituted. So for example, if you had this under 2 group who had to go get a PCR test to end their quarantine, they could, if a site was offering LAMP would also work. So they could be eligible for that. It's really just the antigens that they can't do. So LAMP shows the same thing as a PCR. So it shows, it's looking at the genetic material for the virus. So it can stay positive for a long time as well. Antigen is the only one that should only be positive during during the period while you're infectious. Dr. Bell, do you want to add anything to that?
No, I think that's perfect. And I think that a PCR test is more sensitive because it is looking for genetic material. So it might pick up a positive case before the antigen test, and it will definitely stay positive for longer. And so just so folks don't get confused about, if you're positive with an antigen test, like that's good, that's positive. You don't need to then confirm with another type of test. And that PCR test may stay positive for a few weeks. That's the kind of test we do, for instance, when people are admitted to the hospital. It's that type of, it's a quicker one. But that's why sometimes we get, we have positive cases, positive tests in people who maybe had COVID a week or two, ago. But I think the antigen can be really helpful because it's trying to identify you during your most infectious period. But if you have symptoms, you take an antigen test and it's negative. For us, that's not good enough because we want you to still stay home, take another test the next day and really make sure, because it might take a little bit longer to turn positive. So whereas if you have symptoms and you go get a PCR while you have symptoms, we think that's just one of those is fine because it's a little bit more sensitive. So understanding that is really helpful. Yeah.
I just wanted to make note that Molly there's a very helpful, thank you, Allison, grid on the health department website that I look at 6 times a day about all the different tests, what to do if it's positive, what to do if it's negative. The testing guide is really helpful. So put that on your desktop. The other question that came in that I get 6 questions a day, so I'm going to answer verbally, is the positive antigen on day 10. I've heard Ben Lee, the infectious disease specialist, answer this, that at day 10, you shouldn't be doing an antigen test on yourself really after day 8, because being positive day 10 doesn't mean you're infectious. You're done with your isolation from the regular criteria pre the new changes. That 10 days, you're good. You've had COVID, you're done with it. You can move back into the world and you don't need an antigen test after day, say 8. There's there's a fair amount of people that remain positive antigen tests like day 4 and 5, so they can't leave isolation. But as you get out to 8, 9, and 10, you're going to go out with your clinical, that you've wrapped up your 10 days, because you're not contagious at that point, regardless of the antigen result.
I just wanted to go back. There was a question that we skipped. So Kara was wondering why there are such different guidelines between school age and early education age. Early ed students are allowed to stay if they can't mask the full day, but the school age students must not be in the program. So I'm obviously going to address this, and people jump in to correct me if I say anything incorrect, but basically the difference is that what we're trying to do with the guidance around return to school or return to childcare is keep students in school and keep children in childcare. So if you have a child who is unable to mask or isn't necessarily masking consistently, we want to figure out strategies to get them in childcare and to keep them having access to that care. So we do know, school-age students, unless they have some sort of exemption for medical reasons or something like that, or disability, which we've addressed in another way, are able to wear their mask consistently. So we want people wearing masks. We want them wearing them consistently and correctly. That said, we don't want to restrict those early education students who may not be able to do that, are either not able to mask because they're under 2, or we just acknowledge that they can't mask consistently, but we're still not going to restrict them from returning to school. Anybody want to jump in on that one?
I think just acknowledging, like Katie's saying, but we need to acknowledge developmentally where kids are at, and the 2 to 5 age range and the school age range are very different developmentally. And so that's why we see some different, we see some variances in the guidance.
I guess we can end with, there's a very compelling graph that the infectious disease doctors show about Omicron's infectivity, and the science behind the isolation changes on that 5th day is because it's such a low risk of transmission after the 5th day. So those 5 more days of masking, which you're really calling out appropriately, that might be quite variable for our youth, our young, is like a precaution, and it's sort of important, but not like paramount step. And that's that balance Katie's describing. With that, we get a ton of questions about that. I can totally understand why people who work with 3-year-olds, that child walking in day 6 with a confirmed COVID,
Right.
It might take a moment for you, but we're really encouraging people to work on the masking, but keep rolling with the child receiving the care and coming into the fun program.
Right. So Daisha has one last question, and then I want to wrap up and be respectful of time. Do we count day 0 as the day that symptoms first appeared, or the day of positive test?
So if they have symptoms and they get a positive test, day 0 is the day the symptoms started. If they have no symptoms but get a positive test, day 0 is the day that they took the test.
Great, thank you. So I'm looking at our panelists and really want to express our gratitude for joining us this morning. I'm wondering if there's any last words of wisdom any of you would like to share about how we proceed through these next few weeks, few months, whatever this period of time looks like.
I don't have words of wisdom, but I wanted to thank you all for letting us be here, because I know I can't imagine trying to muddle through all the guidance of everything, all the changes that happen, and you're working with kids who are so all over the place. It's not my forte. So I just really want to thank you for the work that you guys are doing, and just, reminding you that COVID is nobody's fault. It's, we're not placing blame. We're not getting angry with each other. We're acknowledging that this is a part of our lives, and we just want to hold each other up through it.
And I also don't have any words of wisdom other than seconding what Molly said, and just remembering and advising people, keep checking on the Department of Health website for the latest information, printing stuff out and using that as a reference, or any of those kind of things, or asking, Facebook questions or anything like that. Go to the Department of Health website. That's going to be your most up-to-date information.
Brina or Dr. Bell?
Yeah. Just thank you. I think we're in a very important phase in our relationships with each other and the way that we work with families. We're at a pretty important point, and I know it's exhausting And just even hearing us verbally describe things, the amount we're having to process as humans is it's almost too much. So I echo the slowing down with the website and then really reaching out, you know, through Nicole or directly. We're just really here for all of you to answer questions. That it's the clarity comes with repetition, and you start to get in the rhythm of day 0, day 5, but it doesn't mean, I mean, this is what we do every day, all day. It doesn't mean you can carry it. So we're just here and grateful.
And I'll just echo that and say that as someone who, you know, works in the hospital and sometimes takes care of patients with COVID, I take care of children who have to come to the hospital for any number of reasons. And the safety and consistency and support that you are providing children and families in this community through this entire pandemic has been incredibly important. And pediatricians are just so thankful that you have all been there, because there's a lot of life happening that's been happening throughout the pandemic, and you've been there to support our community, and we really appreciate it.
Yeah. Well, thank you to all of you. Oh, Allison, did you want to
Oh,
join
that's
in?
okay. Yeah, I mean, I just echo all of the great sentiments. And I just want to say from our perspective at the Department of Health, I am sorry for all the times that things get difficult because guidance is muddy and not clear on the first day. It's not always within our control. Sometimes it's, you know, policymakers, and sometimes it's us. And I know it's really hard and it makes your job harder. But I want you to know that, you know, all of us here on this call are advocating every day for ways in which we can make it more manageable and simpler and better for you on the ground. So keep your comments coming, because they really do help us know what to advocate for and what works for you and what doesn't work. So your feedback is really important to the process. And so I thank you for that. And I know it's a bit of a bumpy road coming up because a lot of changes are happening, but I think the other side of those changes is a much better place for all of us. So thanks for bearing with us for this next couple weeks to a month as we get through to the other side of this change.
Yeah. So thank you again to all of our panelists and to all of you for joining and for being here today. 3 keeps: keep checking the website, keep telling us what's happening on the ground so that we can advocate for you, and keep supporting one another, and we'll get through. All right, you all, we hope you have a great day, and thank you again for joining us.